County Commission Health and Human Services Committee to order. Madam Clerk, what's up first?
Commissioner Marecki. Here. Commissioner Dobb. Here. Commissioner Anderson.
Here.
Commissioner Baker McCormick. Here. Chair Colleen.
Present.
You have a quorum present.
Thank you. Before we roll on to the approval of the minutes, I'm going to want to make one small change to the agenda, and that is we're going to move the report from the department on coronavirus, their PowerPoint that they're giving today, right up to the first item, and then we'll do the rest of the agenda as it's written. So what's next on the agenda, Madam Clerk?
A presentation by Carol.
No, we got to do the B.
B, approval of the February 25th, 2020 meeting minutes.
Pleasure of the committee.
Support.
Are there any additions, corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed? All righty. Madam Clerk?
C, unfinished business. There is
Okay.
none.
All right, so we'll go to new business, item 6. That's been moved up to the front. Presentation from the Department of Health, Human and Veteran Services on the coronavirus. Ms. Osterberry, thank you for bringing that with you today. So we are ready to roll with that.
Hi, Carol Osterberry, Health Officer. I'm going to pop over there so I can hit the slides.
Sure.
And I guess just as a preface, I mean, we've been doing these slide presentations for about a week. It seems like it's much longer, I will admit. We've, for the cabinet, elected officials, I know Commissioner Colleen was in one of the meetings. We are also rolling out a campaign, certainly for, employees, and it's to make sure it's a very consistent message, but, we are here for everyone who works in the county, who resides in the county, who, has questions about this very fluid and moving topic, but yet there are a lot of pieces about it that are very, consistent. So I know Janelle was going to try to get down here, but with that, I can start the presentation. And it actually, I'm pretty sure this will all work. There's a very nice, little 4-minute video. So let me do a couple clicks and then you'll see this video, and I think you'll like that. So again, this is just the first slide. Enter. I'm the presenter. And introduction. So, here we go. And
in December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. Sites below for the most up-to-date information. In this video, we'll take a quick look at what's currently known about the virus.
yeah,
Keep in mind that this
I
is
apologize,
a new
we
virus,
can't.
and what's known about the virus now
Can you
might
hear it?
change in the future. Coronaviruses
okay.
are a large group of viruses. They consist of a core of genetic
there.
material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Great. Yes. Yes.
Before you continue on, I'm just going to comment as a biologist that they're identifying this by polymer chain reaction, PCR, which is one of the great advancements in science in the last 30 years. This is how we can take trace DNA off of a little something on somebody's shirt and solve a crime by it, because it takes just a little piece and it amplifies it to enough DNA that you can actually identify stuff. So PCR is unbelievably fantastic and what it's done for our society in so many ways. So back to you, Ms. Osterberry.
Great, thank you. So, prevention, as the slide said, but we are, honing on, just driving this home. Wash your hands. Wash your hands, wash your hands. Cover coughs and sneezes with a tissue or your sleeve. I think many of us are used to that. Stay home when sick. Avoid touching your eyes, nose, and mouth. Avoid touching your face. But again, wash your hands for at least 20 seconds. That's I think singing happy birthday, saying the alphabet twice. Wash your hands. Make sure you're washing the back of the hands, in between the fingers. All of that good personal sanitizing, personal hand washing is very, very important for this. So the worldwide status, over 100,000 cases are confirmed, over 4,000 deaths, and over 100 countries have been affected. And that public concern by the community spread that we're seeing and from an unknown or untracked source. But this is yet still not categorized as a pandemic. I know myself, I heard on the national news last night that I think they were interviewing the chairman of the World Health Organization, and that was still the case that I heard last night. It is not considered a pandemic. United States, 554 confirmed, 32 states affected, 22 deaths reported. Michigan, and this is 0 confirmed cases, 36 have tested negative, and 11 that are actively being monitored. And then Wayne County, 0 confirmed, 0 deaths, 3 patients meeting testing criteria, and 8 actively monitoring. Yes. So who is at risk? 80% of those who have died were over the age of 60, and 75% of those had pre-existing health conditions. So we're finding this is really having that impact on those older adults who have an underlying or pre-existing health condition. So then the threat to Wayne County, so what this slide is saying is, I'll take the top line, if you're 80 years or older, have contracted the disease, say if 100 people are 80 years and older and have gotten the disease, 15 of them have a probability of dying. And then again, like I said earlier, the risk factors that increase the probability of death: cardiovascular disease, diabetes, chronic respiratory disease. Because what is causing the death is pneumonia. So our preparedness and response measures. So we have point of dispensing sites throughout the county. I can tell you there are 17 open point of pod or point of dispensing sites, and we have over 70 closed pod sites. An open pod is a location where the public would go. Closed pod sites are where someone from that organization, my example, easiest example, all of the municipalities for their first responders, the firemen, the policemen, have agreements with us. They would come to the health department or come to our distribution node, collect the medications, and then take them back to their, like let's say, example like the Allen Park Fire Department, take them back and then distribute to the employees and their families, rather than everyone having to come to those open pod locations. We have been working with the community. Trainings, workshops, and educational materials have been going out, and trainings with those closed and open pod partners. Daily conference calls we have with all the different response partners, be it the state, the Center for Disease Control. There was a call today with the state for the medical providers, a public awareness campaign. We have partnered with The Information Line, and that's the phone number. This is a nonprofit business that is located in Taylor, and they actually had approached us and were able to work with them. This slide is a little bit, we also have 211 that is also able to take calls when the public calls and asks questions. And then there are non-pharmaceutical interventions. Okay, then we have been getting comments about stigma and regarding this. Everyone wants to make communities and community members resilient. Be cautious of information and images that you share in person or on social media. Make sure that you're not reinforcing stereotypes. This is part of our campaign, Speak Out Against Negative Behaviors, including negative statements. Social media, it seems, can just sometimes people can put just a lot of things out there that really aren't nice or aren't accurate, and we're working on, making sure we're addressing that also in the community is what we're saying here. And then maintaining privacy and confidentiality of those. A lot of people, oh, Carol, what do you know? And, if that were your loved one, or you would want, their medical privacy maintained also. And that is it. Are there any other questions?
Members? Commissioner Anderson, you're up first.
Carol, could you give us the link to that? That we might be able to share it even to Facebook folks that might
Yes, I will,
be able
yeah.
to get some reliable information.
And I believe also now there is a page on the Wayne County website
Yes.
that updates this, and so maybe send that around as well. I've been sharing
Right.
that link.
Right, our public information officer, Mike McElrath, has been updating and getting all of this information out, very consistently, so certainly all of that will come out.
Okay. Questions from committee members? Are you done, Commissioner Anderson? Commissioner Dobb?
Thank you, Mr. Chair. Has the county been able to easily access testing capabilities when requested?
Yes. And I say that because I think there is, we have not had any problems with having residents who meet the criteria, getting testing. I don't know why it seems like that's kind of a rumor that's going around a little bit. But no, we have not experienced any problems. The state has not come down and said, you have the limit. No, not at all.
Okay. What exactly are the testing criteria?
Yes. And I'm using my notes because this is kind of fluid. And I want to make sure. All right. So, if a patient has signs and symptoms compatible with COVID-19, hospitalized patients who have signs and symptoms, and then other symptomatic individuals, such as older adults, and they classify that as greater than 65 years, individuals with chronic medical conditions or are in a compromised weakened immune system, so weakened immune system, and then also if they have like I said, that underlying medical condition that could cause complications such as diabetes, heart disease, someone's has cancer and is receiving those immune suppressed medications. And then the last, any persons who within 14 days of symptoms or on-site had close contact with someone who was suspect or lab-confirmed patient, or who had a history of travel from one of the geographic areas. And as of Monday, that's yesterday. So those travel areas: China, Iran, Italy, South Korea.
I just have one more question. What is the time period of when someone gets tested to when they can know if they're positive for the disease?
Our experience with the state laboratory has been about, this is almost too much information, but, about 24 hours. It could run into 2 days, depending on when those samples get to the state lab. We're told they do one run a day, and it's like this 10 a.m. time frame if things don't get there by 10 a.m. to get on that first run. So, and I will tell you, we do everything we can, make sure they're aware samples are coming up. If it's 10:03, is what I'm saying. But pretty much, they've been real good about, getting right back to us, but it could be 2 days if it misses that run on the day.
Okay, thank you.
Commissioner, before I go to Commissioner Baker McCormick, I want to follow up on that a little bit. So, testing. Can somebody just come out to your office and say, I want to be tested? Is this the kind of thing that a physician's going to say, hey, I need a test kit? how is it that people are tested? Can you walk into your doctor and say, I want to be tested? What's the criteria for who gets a test?
Right, just what I wrote off are the criteria. No, we do not have test kits available to collect samples at the health department. So someone cannot come to the health department and get that, that sample collected. And then to answer the last question, as far as where samples would be collected, that would be a variety of places. Kind of depends on where that patient is. I know myself, like at my doctor has a lab right there, that will collect samples, if I need lab testing. But I'm not, so it would be a variety of ways.
But the collection's going to take place in some sort of a medical care facility in order to do the testing.
Right, with the doctor's note. Or not note, doctor's orders.
That's what I was getting at, because, given how it is out there, no, folks, you just can't go running to your doctor going, I want to be tested, I want to be tested. The doctor follows criteria.
Yep.
Correct. Yeah, just want to be clear on that. Commissioner Baker McCormick.
Thank you. So if you are diagnosed, what is the next step? Is it self-quarantine or is it?
Right, now there isn't a vaccine, it is supportive care, for your medical condition. So now that is more a discussion between, you and your physician, if indeed you're sick enough, you're in the hospital, or depending on the symptoms, you could be self-quarantined at home. Because as I said earlier, it's pneumonia that sets in.
So how does that work, self-quarantine?
As far as someone staying
if-
at home?
Yeah, I mean, are they monitored or do they just say, go home and take your meds and stay in the house? And, there's no one to, I guess, keep track of their movements. So if I had it, God forbid, what would stop me from moving around? That's what I'm asking. If there's just self-quarantine.
Right. That's a good question. And we haven't had a case, so communication with the health department. If you're at home, and a lot of times that's via the phone, maybe it's on FaceTime. Again, we set that up with the patient. We do this with like TB patients. But as far as, and then it's staying at home because you're sick.
Okay. And is there any, I guess, a location for if there was a massive amount of people that develop the disease? Is there an area or place that we have set up for them? Is it the pods or is it?
Right, no, and like I said, you want to be either at home or if you're sick enough to be in the hospital.
Okay, so it's just the hospitals or at home right now?
Right.
That's what we have, okay,
And
okay.
it's not like house arrest. You don't have a tether.
Right.
Right,
It's kind of up to the individual.
right,
I'm sure everybody has heard that like all of Italy is on lockdown now.
right.
But they still have public transportation. People, although not a lot, it's not martial law. So it's the cooperation. We've been joined at the table, name and title. You have some input here, please?
Janelle Allen, Chief Operating Officer. And I think Commissioner Colleen, you just hit the nail on the head. We're not under martial law here. We actually are relying on people to exercise sound judgment and to isolate themselves if they are sick or they will be in a hospital. We do have established protocol, which we actually had established back at the beginning of last month. I remember Carol and I were on a conference call with state officials on Super Bowl evening, because that's when flights were still coming in, and Detroit had been designated as one of only 11 airports to receive flights from China. We had to have a protocol in place that if someone was screened as they were coming in through border control, that if they were not symptomatic, but they had come from the region where they were at high risk, we had to be able to have them transported to a location where they were going to be quarantined. And we set that up with the city of Detroit. They asked us to work together because we're all in Wayne County, where we do have an established protocol at that time when someone was not symptomatic. If someone was symptomatic, we had another location where they were going to be transported to.
Thank you.
And we're sensitive about locations.
Correct.
Again, for the, but, so the report is, this is what the setup is. Commissioner Baker McCormick, you still have the floor. Oh, okay. Commissioner Anderson.
Thank you. I might have missed it, and I apologize if it was mentioned. When someone is exposed, how soon do they show symptoms of it?
It's a 14-day incubation period.
Because I've heard 10, and then I heard 14.
14, that has stayed consistent. Oh, but yeah, it's a 14-day incubation period, so it could be up to 14 days.
So if someone thinks there's a possibility, if they've been on a cruise or if they've flown somewhere, one of the affected countries, then they would probably be best to self-quarantine for the 14 days in order not to spread it to anyone else, even if they've not showing symptoms before that, right?
Yes, I think if they're in a high-risk group, yes.
Okay. And I you don't need to pass along, I found that it's on the county link, the video that you showed.
Oh, look
it's
at there.
It's on there. So I can pass it along from there, I guess. Thank you.
And where did you find that, Commissioner Anderson?
On the county website.
Okay.
Yeah.
But I still think it's a good idea to email that out to everybody with the link.
Sure.
You took personal initiative.
Thank you.
All righty, Commissioner Marecki.
Thank you. Commissioner Dobb and I were just in Washington DC for a conference, and we had the head of CDC come in, and there was another talk. And their big emphasis at this time is to stay away from masks.
Right.
Because the healthcare workers are running out of it, and people are exposing themselves as they take off the mask, put on the mask, which that video does say proper use.
Right.
But they were really discouraging it because I know I have a bunch of nurses in my family, and they're actually signing out the masks now. They're not just giving them out because they're afraid of running out.
Yeah.
So I just didn't know if that was for promoting masks at the county.
Yeah, no, we're following the CDC guidelines.
Yes, okay. Thank you.
Viruses are kind of small, and a mask that you're not wearing properly offers no protection. Commissioner Dobb, you want to back in?
Yes, Mr. Chair, thank you. Just one more quick question. The daily situation reports that we've been receiving by email, are those okay for us to send out to our constituents to post to the public, or are those just internal for us?
They are now. I think when they first started, there was more additional information in it, and actually, one of the commissioners brought it to our attention that we removed where it said unclassified, so it should be saying
Okay, so as
that
long
it's
as it
free
says
to pass on.
unclassified, we're
Yep,
good to pass
yes.
it on to the public? Okay, thank you.
Yes, and I do know that all the municipalities are receiving them through like their emergency managers and, all the commissioners, and, that list is, very robust as to who gets that every day.
Okay, great, thank you.
Mayors, city council members, is it like all elected officials in the county are receiving this?
They should. I
yeah.
would double check to make sure, but they
Okay.
should be receiving it now.
Because that was one thing I raised, that,
Yeah,
because
yes.
we're all getting questions, right? From our local, right, city council people, what is the county doing, that kind of stuff, so if they can hear it right from the horse's mouth. Commissioner Dobb, anything else on that? I think I heard the Center for Medicaid and Medicare Services say that the cost of the testing now is going to be covered. Is that accurate? I thought I heard that on the news last night, that for people with Medicaid and it won't be an out-of-pocket cost, but that Medicaid, Medicare will pick it up. You know something about this, Commissioner Marecki?
I saw something that Blue Cross was going to cover
Yeah, so
too.
what do you know of that?
Just kind of what you have just stated. I mean, I don't know anything real specific about that, no.
Would that be possible for something you put in your daily briefings?
Sure.
To get that information out? Come on up and join us, or go to the mic. Name and title, and please add your contribution.
Little button.
Here we go, help's on the way.
Thank you, Mr. Chairman.
That still didn't do
Still
it.
not, still.
Oh, there we go,
it is,
thank you.
okay. Just to answer your last question, Alan Holmkamp. I'm going to read you from something I found online this morning to the question you just raised. The good news is major health insurance companies say they will pay for the test, so it won't result in a big bill. Governor Gretchen Whitmer announced late last week that Medicaid will waive copays and cost sharing for coronavirus testing and treatment. So if she's accurate, then that sounds like good news.
For that, so if we can get that information out into the daily,
Right.
Commissioner Marecki?
Just two things, a comment that I'm very thankful that all these flights were stopped when they were, because this could have been really a nightmare. But the other thing is too, is the cdc.org is a good spot to have the updates from the country, statistics that's being always updated. So that's a good site just for anybody that is curious.
Mr. Helmkamp, you have something else to add?
Yeah, I'm sorry, I just know just enough to be dangerous. CDC sites.
We're all too well aware of that,
Suggest
sir.
that, you know, they're not using the word inevitable, but 38 states have it now, and for us to totally avoid it would be almost miraculous. When you look at Italy, they went 2 weeks from having the first case to a total lockdown. And I would just suggest to our people that the people who are ahead of us in the loop are Washington State and New York City, where they're two known hotspots. And it's progressing like, where are the lockdowns? So they're going, you know, no community meetings, then schools, then whatever. So I would just suggest that if it's inevitable that some of this is ahead of us, we may look to some of those other folks who are ahead of us on the curb to maybe gain some knowledge and protocol from that.
Yeah, thank you. It is inevitable. If the 1918 flu, which killed 20 million people worldwide, could spread over the entire world, in our connected world, it's happening. Commissioner Marecki? you
Yeah,
got-
and that was a very different flu. I mean, you'd get on a bus and not feel good, and 2 miles
Right.
down, you'd fall out of the bus
But nonetheless,
dead.
what I'm talking about is transmission, right?
And
Once
you know
it's
what?
out there.
And also too, when you're talking about looking at pockets, like in Washington, I think 13 people have died in the state of Washington. 11 of them were in a nursing home with very medical, older
Right.
people. And so
Yep,
it makes the
exactly.
statistics go up.
Yeah.
And it's really the people that are older and that are compromised in some way. And you'll notice, no children have died of this.
Right.
I don't even know if they've have gotten it.
Yeah, I
It
don't.
seems to be not hitting
no,
children,
no.
which is kind of odd.
Well,
So-
I'm wondering actually if for young people, and this is why mortality rates are so hard to figure right now, but I'm even wondering, and we'll learn about this later, that it may be for young and infant, that this is actually acting as an immunization shot for them from contracting later on. I'm sorry, Commissioner Baker McCormick.
Thank you. So what you just talked about goes to the prevention of the spread of it. And so that's one of the reasons I asked about quarantine and what we were doing to be proactive around that. And I know that, you know, like you said, there's no martial law, but maybe there should be some other ways that we quarantine people that have it. Because maybe maybe when you contact it or you get it, and in other states, they kept moving around, even though they weren't supposed to. And then you have a whole city that ends up locked down because there are folks that will continue to move around when they're not supposed to. So, not really sure how we look at that. Could we look at any other ways of making sure that those that are exposed stay at home or stay in a isolated place? I don't know, but I think
I hear you.
in other states, maybe that is why it hasn't spread. Maybe they came up with some other ways of preventing the spread of it. So I don't know.
I think our approach has been, because we don't have martial law, and I don't think anyone is recommending that at this point, it really is about saturating the market with education and understanding. And so it is about, if we each take our own responsibility for keeping ourselves healthy and even just our loved ones, you are going to do that just out of respect, if you will, for yourself and others, that you will stay home if you're sick. You will constantly get into, I myself have been, so now I'm already a minor germaphobe, so I had plenty of disinfectant wipes and hand sanitizer. I'm even doing it more. So I think what our approach here in Wayne County is really about education, education, education. And one thing I wanted to bring to your attention as well is even focusing on our employees. We will be sending out a communication this week, just going over some basic things, but also letting them know that we have placed bulk orders for disinfectant wipes and hand sanitizers. Unfortunately, because of the stockpiling that's going on, we haven't been able to get as much as we'd like, but we are expecting, and I just spoke with our emergency preparedness director before coming here, where we have received at least 400 bottles, but they're the small 8-ounce and 12-ounce bottles of hand sanitizer. We're trying to get the 67-ounce bottles, especially for those in the public areas. So we have placed these orders. We worked with procurement to follow the emergency procurement rules. We placed our orders. We couldn't get any confirmations before yesterday morning, and we're still waiting. But those are the types of things we want to just have constant supply, and that's going to be reminders to keep your areas clean, keep wiping down. I know that our elected officials whose employees have constant contact with the public have even a heightened concern. And while the CDC had not recommended any enhanced janitorial cleaning, we have even agreed where we will have, they're actually trying to get a vendor who will come in just constantly wiping down the surfaces in the public areas. So again, what we're also having printed material up and very user-friendly guides that we're also having hand-delivered with our Meals on Wheels home deliveries, as well as at the congregate sites, for people to just be informed and to just really focus on your own self. So that's how we're going to help minimize the spread. So that's what we really are focusing on, as we are in a democratic society where people do have freedom of movement. And like I say, I think that what is happening, that we are learning, as Ellen suggested, we're learning from others who have done this before us, and which is why we're trying to get out to saturating about education, 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 and don't panic. We wouldn't have a shortage of supplies if people were not panicking.
And is it fair to say that the education efforts and the actions that people are taking based on that is changing the trajectory of how much the virus spreads?
In all candor, we don't know yet.
Well, we want to get out
Without
what we know,
candor,
right?
But that's exactly right, yes. But we are very hopeful that as you say, people are well informed about what the virus looks like, how you catch it, how you spread it, that is going to help slow it down.
And have we taken, are the things you've listed, like what we're doing with our employees, are all those things in your daily updates so that people can see that?
Well, that is, I would say that we want to send an e-communication first to the employees so they know this.
Yeah.
And then we can be doing that. So that's what we're working on finalizing. Yesterday, we did send a news release about just letting people know that Wayne County is prepared. and to let our seniors to know we're focusing on our especially vulnerable populations, as Carol said, our seniors and those with underlying illnesses. We had actually last week had already reached out to community partners where they are sending out our information to their own constituency groups. Our employees are equally important, as we said, so we're focusing on a awareness campaign with our employees now. And so that'll start with like e-communication this week, letting them know. Meanwhile, we've ordered all these supplies. In fact, that they're being contacted as we speak with that first batch of supplies about how they can be dispensed, as Carol said, through our already established point of distribution systems. So as far as when you're saying updates, what we're doing, we can start putting those in. Right now, we're focusing on actually getting it done, and then we can start
No,
reporting
that's
on it.
understandable, but what I was thinking in those daily updates, especially of mayors and city council people, that might offer some leadership, because it's like, what are we doing in our public buildings and with our employees? And it may give local
Yes.
communities some ideas of what the steps are that they might want to take
Yes,
as well, if they see the steps that we're taking.
We've had, I believe, our first batch, we're having 10,000 copies of this 4-page user-friendly guide, which is going to be hand-delivered to our seniors, and we'll just be distributing those elsewhere. We also are having, and some of you saw these, we have posters that we're having also being plastered up into the offices. It's just a constant reminder about cover your nose and your mouth, keep washing your hands, use hand sanitizer if you don't have it, have disinfectant wipes. Those constant reminders for sensitivity.
As our health officer, Ms. Osterberry, I want to ask you, it has been out on national television, an allegation that this is all going to go away when the weather warms up. What do we know about that? What do we know about that?
I think there are lots of rumors and information going out there. I have not heard that. I have not
From
heard
health
that.
experts, we have not had confirmation of that is accurate.
Yeah, because we don't, what we know is maybe yes, maybe no, but we don't know for this specific, because not every virus goes away
Exactly. Right.
come
That's
70-degree
correct.
weather, but some do. So again, I want to have accurate information out there. So the answer is, we're running the experiment right now, and we'll tell you when the weather warms up, whether that's true or not,
Exactly
correct?
right.
And that's the only way. And Commissioner Marecki, I'll get you in a sec. There was, well, go ahead, Commissioner Marecki. I had one other question that
Had a-
just went through my brain.
Statement too, and they're seeing now the cases are leveling off and going down in China.
Yes,
So
I've
this
heard
is
that.
going to be cycling through the countries, and if we can just contain it with all the information you're
Yes.
giving
Yes.
everybody, then it's going to hit a cycle and go out like all the other things, the N1H1, the, what was it, MERS? I mean, those were big-time things, so, anyway.
But in an abundance of caution, and me personally, I'm not trusting the data coming out of China. They got their own reasons for why they might run a report, you know, how much they're actually experiencing, impacting, especially with the global fiscal consequences to this. So I'm not trusting that data, but the experiment is going on, and we will see. But there is no, from health officials, there's no like, yeah, this is going to.
Right, no, and we're using the World Health Organization and the CDC as our, sources of information to, again, to be consistent, to be accurate, that again is.
Well, and also for you, Ms. Osterberry, because Commissioner Baker McCormick asked about it, is it fair to say that in planning for these things that there are, depending on the severity of this or other future things that we will see, that in the plans there are steps, if it turns out to be very severe, in plans that are more than just suggestions for what the population should be behaving towards it, that there are a little more stringent, perhaps regulations. I think you walked right up to it and didn't say that. But in the plans, there are, if it is very severe and very threatening to the entire population in a real way, then there are steps in emergency guidelines for, I don't know how you want to say it because everybody's concerned about the panic, but for actually controlling people's movements. Is that accurate to say?
Yes, I mean, our plans are,
Yeah.
thorough, complete.
Yeah, so if we get there, Commissioner, where it's really like that, then there are further steps that are in everybody's emergency plans to control it. Mr. Helmkamp, we'll let you have the last word on this, Mr. Helmkamp, which I know you delight in.
Again, as to that point.
Yeah.
And I might suggest that if you could have someone from Corp Counsel perhaps assigned to this. I'm just going to share two quick things with you. COVID-19 is what's known as a quarantinable communicable disease under federal law. That's already been determined by the CDC. And there's a line of cases going back into the 1800s where the Supreme Court has said the power of the states to enact and enforce quarantine laws for the safety and protection of the health of their inhabitants is beyond question. There can be orders to prevent travel, require vaccinations, make people submit to medical exams, and stay in quarantine. So I might suggest if you assign that to somebody, heaven forbid we have to go there, but you might have someone already looking at that and being on top of that if we have to resort to those extreme measures.
Yeah, thank you. And I think people should just keep that in the back of their mind. That's the importance of the steps that we're taking now to mitigate it so that we don't get to that point. But I think world history will show us that we have to have that in our plans and in our hip pocket. If it gets to be that severe, then we can't be like, okay, what do we do now? That's already part of the plan. So people should just be aware of that. That's just good planning, that you plan for all possible, including the worst-case scenario. So there is plans for that.
And I do want to assure you that we have done extensive research and are well familiar with the extent of the public health officer's authority. I would tell you.
Any questions from committee members? I want to thank Ms. Osterberry for you coming over for this presentation, because we are, you know, this is one of the things that this is an unknown out there, and everybody in the world is feeling this. So thank you very much for the presentation and getting us up to date on the current. Everybody check their email every day. Please let your local officials know that are contacting you. Look for the email coming from the county every day that can keep you up on the trajectory of this. Anything else that ought to be mentioned? All righty, thank you.
Thank you.
Thank you.
Madam Clerk, let's return to the agenda.
Item D1 under new business, requesting commission approval of a contract modification 29 to a contract with 3 one-year options to renew with Black Family Development.
Okay, the first 5 items, the ones that came before the addenda, are all the quarterly reconciliations with our CMOs based on the actual
Everybody go.
traffic and claims that they submitted.
For once, I don't, I'm,
It's all right, it's all good. So if it's the pleasure of the committee, we could take a motion and deal with all 5. Are there questions on items 1 through 5 for our CMOs?
Items 1 through 5.
Support.
And their support for that. Any discussion of those 5 items? All in favor of the motion, then, please say aye.
Aye.
Aye, opposed? Any abstentions? Madam Clerk, I guess we're on the addenda, item 7.
Item 7, requesting commission approval of modification 1 to a contraction contract with Clark's Construction Company.
Ms. Osterberry, are you, I know, you're doing
I knew I had other things.
several things, but we appreciate your pitching in on the AV work, too. So this is a addenda that came. You know, I talked about it with staff when they called me about putting it on, but since it is an addenda that's yesterday, can you please go through this? Lead abatement is always a great concern. So please go through
Yes.
what this is.
Yes. So when we start, Carol Osterberry, Health Officer, Health, Human and Veteran Services. So when we first were awarded this 3-year grant through HUD for lead-based paint abatement, through procurement, we had 4 contractors that submitted bids to do the work. One of those contractors, they didn't really give us a reason why, decided that they did not want to do this work. So in order that we can then use the money that was allocated to that contract, do you see what I'm saying? We have then, and there will be a third one coming, because I think you've got 2 amendments, correct? Then there will be a third one coming for the third contractor, an amendment to their contract. They just didn't get us all of their documents in time. So it's that we don't want to leave money unused for lead-based paint abatement in the homes in Wayne County. Did I explain that? Thank you.
Well, we'll find out in a minute. Whole bunch of questions, then maybe, I kind of walked through the numbers. Do we have an extra addenda printed out? Just to make sure we have numbers, because this is amendment number 1 to a 3-year, oh, yeah, I want you to see the analysis that was done by staff. So this is Amendment 1 to a 3-year contract with a 1-year option. The amount of it here says the cost of Amendment Number 1 is in the amount of not to exceed $169,000. So that would increase the total contract amount from $536,000 to $706,000. Is that correct?
That is correct.
Because then the next thing I see is subcontractor information, and you have, and I'm looking at two $25,000 amounts for K&D restoration and Great Lakes restoration. And I don't see the $169,844 figure that this is being increased by. So the increase, the $170,000 increase here, where's all that money going?
To the homes.
When you say to the homes?
Well, so that we can do the lead-based paint abatement in the homes.
Okay, so there's that much more, $170,000 more for us to go out and inspect and abate in homes?
Abate.
Just the abatement itself. How many homes do we have? Even with this amount of money, are we able to cover the request or the whatever we get on this? Or
Yes. Yes, I don't know how many homes we have completed. I know the grant, 200 was the number in the grant.
And can you please refresh our memory in terms of how it comes on your radar that there is a home that needs abatement? Can citizens call that are, well, first of all, do we have a map showing the areas where the homes were built before, whatever it was, 57, that still have lead bait, so that citizens are aware? 60-something?
No,
Was it 70?
78.
Yeah, because I remember there used to be the Lead Paint Company in Lansing, Michigan, over by where the minor league field is now, right in the heart of it. And I was up there at the time, and then a few years later, they suddenly became the Murphy Paint Company. Yeah, we'll put an Irish name on it. Isn't there a map out there that shows where these homes are and what communities have these homes? What I'm getting at is, how do citizens know this is available to them?
We do a lot of community outreach, and as I've explained, we also have the full-time public health nurse who every week receives all of the lead test results from the state of Michigan for the children in Wayne County, outside the city of Detroit. And then that is another way that residents, she contacts the family, and then to determine, where is the source of the lead that child, why that child has an elevated blood lead level. And many times that's how they come in. Other times it is through all of our community outreach at events. We did a lot with all of the communities that had the action level exceedances last summer, remember, with the water?
The water testing.
Right. I mean, we are out in those communities in many, many different, venues and ways, letting them know about the grant program, and certainly the priority being for those children, like I said, who are going through the case management with our public health nurse, that's a very common way, because we want any lead exposure to be eliminated.
You mentioned data from the state of Michigan.
Yes.
Is because I believe that we are now collecting with neonates a blood sample,
I
I
don't
believe.
know.
Where is the state getting their information for what infants or children have elevated levels?
I mean, a pediatrician can do the test. My public health nurse can do the test. The WIC clients, that's part of the WIC, appointments. Has your child had a test? Oh, they haven't? Okay, let's make you an appointment with our public health nurse. I mean, that is a very effective method for getting children tested. All of those test results then go back up to the state, and then that's how then they come back down to every local health department.
I guess I was under the impression that somehow, right in the delivery room, shall we say, or other, that for neonates, a blood sample was being collected.
I am not aware.
Yeah, as with everything, I could be dead wrong, but I thought I had heard that at some point. Questions on this item with lead? Commissioner Anderson?
Thank you. Carol?
Yes.
Pardon me if the last time this came through, if I'd asked these questions before, it seems like I might have. But I wanted to ask, are these companies all vetted as far as they're state or federally certified to be companies that are responsible, do the job, dispose of the lead-based paint properly? And
Yes, one of the requirements under the RFP is that they are certified by the state of Michigan for the abatement work, absolutely.
okay. And do we do any type of analysis on the particular home as to, once they determine what they estimate the cost is going to be to abate the lead in that home, if it's going to exceed the value of the property to begin with? Is there anything that's done? I mean, what I'm thinking about, what if you get a house that's worth $30,000 and you could build a new home maybe rather than spend another $80,000 or $100,000 to abate the lead in it?
I hear what you're saying. Realize it all
Might be able to
starts.
build someone a brand new home.
Right. It starts with that lead inspection risk assessment, and then after that is conducted, then the contractor with one of our with our program manager goes back into the house to, build that scope of work. So, I do hear exactly what you're saying, but I also know, a child that is lead poisoned, and that's their home, we need to make sure that the lead-based paint is taken care of. But there are a lot of factors, and as with anything, it's my reassurance to you is that we are involved in that process. It's our employees that do the lead inspection risk assessment. It's not the contractors,
Okay.
and so then that last other safety net is then it's the contractor along with the program manager who is out physically in the home to make sure that it's the lead-based paint hazards that are being abated.
Yeah, it just seems like that would be part of the equation to determine whether or not the home is worth a lot less than it would be once they dump or put $100,000 into a home, for the lead abatement.
Right.
And then it'd still only be worth $30,000 when you could buy them a brand new home or build them a brand new home. And so these inspections are, and the work is audited? Is there someone that audits to make sure
Yes. Yes,
the
again,
work
we have
is
a.
done and done properly?
Oh, absolutely. We have a project manager, and then we have a program manager and project director. Project director also, he does the quality assurance checks on the property file when it's done. And again, like it was said, we've got a lot of checks and balances in that whole process.
Okay, all right, thank you.
The next item on our addenda, Ms. Osterberry, is also lead with
Right.
DMC. Did we split the bid? Did we put this out for RFP and award 2 contractors? Is it basically under the same RFP?
We put it out for RFP and 4 contractors were awarded. One contractor decided, terminated their contract,
Yeah.
not,
So we did split the bid,
So then there were 3 contractors that all got awarded, yes.
based on their capacity and that
That's
sort of thing.
correct.
Okay, so colleagues, we can deal with both of these items in one motion, if that is the pleasure of the committee. Questions on lead and, all right, pleasure of the committee? So the motion is for items 7 and 8 on the addenda today. Did I hear a second? Yeah. I heard a second. Any additional questions on these 2 items? All right, we'll go to a vote. All in favor of the motion on the floor, please say aye. Aye. Opposed? Are there any abstentions? Thank you. Madam Clerk, what is next on our agenda?
E, such other matters as may be properly submitted before the committee.
Anybody have some such other matters? Some such other matters? Hearing none. What's next, Madam?
Public comments.
Any member of the public wish to address the Health and Human Services Committee? Any member of the public wish to address the committee? One last time, any member of the public? Seeing none, Madam Clerk?
Adjournment.
Without objection, the committee stands adjourned. Thank you, everybody.